Hi friends, this is Srividya. I welcome you all to my channel on Cardiac Essentials. Like we were talking about aortic wall repair and replacement in the previous video, we'll be continuing to talk on aortic wall repair and aortic wall replacement. These are the two types of heart wall surgery which can be done in a minimally invasive way. So basically why they are done? They are done to the patients whose wall is completely damaged, or when it is beyond repair, the aortic valve is replaced. And if it is in a very initial stages, either the surgeon would go suggest repair of the valve, or they can be cured with medications. So aortic valve is one of the four valves that controls the blood flow in the heart. So where does this aortic valve lie? It lies between the lower left chamber and the body's main artery called the aorta. So heart valves, what do they do? Like heart valves keep blood flowing in the right direction through the heart. So when the heart is squeezing the blood, the aortic valve opens. Blood flows from the lower left heart chamber into the aorta. And when the heart is relaxing, when the heart relaxes, the aortic valve closes, which prevents the blood from moving backward. So what happens is, when the valve is diseased or damaged, it can change the flow of blood. So what happens is, there is extra pressure, the heart has to work harder. The extra pressure on the heart has to work harder to send the blood to the rest of the body. So when we are talking about aortic valve repair or aortic valve replacement, this is done basically to help improve blood flow and reduce symptoms of heart valve disease. And also it helps in having a long life for the patients. So it can be done in two ways. Either as a open heart surgery, or like we were discussing, in a minimally invasive procedure. So both the way it can be done. And aortic valve repair and aortic valve replacement, these both are, like we were talking before, are done to treat aortic valve disease. So now we'll be discussing what is this aortic valve disease. And we all know when is a repair done and when is a replacement done. And also you might have come across this aortic valve regurgitation. So what happens is, the aortic valve doesn't close, the valve is not able to close properly. So when the aortic valve is not able to close properly, what happens is, it causes the blood to flow backward into the left lower heart chamber. So what happens when the blood backflows into the left lower heart chamber? So this all happens, like it can be, depends on the severity of the condition that damages the aortic valve, that causes the regurgitation. Sometimes even we can talk about infants. A baby is born with a irregularly shaped aortic valve that leads to regurgitation. Then the other procedure is aortic valve stenosis, the aortic valve. When do you have to replace the aortic valve, either repair or replacement, is aortic valve flaps called the cusps. They become thick and stiff, and they connect together, because of which the valve becomes narrow and is not able to open fully. So when the valve is not able to open fully, this blocks the blood flow. So when the blood flow is blocked, there is reduced amount of blood flow. So this is called the aortic valve stenosis. So it can be present at birth or by some kind of infections in the heart valve. So the other type is aortic valve problems. Those are present at birth, called congenital heart defects. So there are babies that are born with an aortic valve that's missing a valve opening, or that has 2 valve cusps instead of 3. So a congenital heart defect can lead to the valve to be wrong size or shape. So this also needs a surgical procedure. So if there is aortic valves, then this kind of thing also needs a aortic valve surgery, like I said. So if the valve disease affects the heart's ability to pump blood, then a surgery has to be done. So sometimes it is asymptomatic if the condition is very mild. So what the surgical team will do, or the healthcare team, they will try to come up with a diagnosis, try labs, and try to evaluate the present conditions. Or they will, with the evaluations, if the condition is mild, they will try to correct it with the medicines and lifestyle modifications. But mostly aortic valve conditions will end up eventually in a surgery to lower the symptoms and avoid the risk or complications such as heart failure. So like I said, the decisioning to repair or replace a diseased or damaged aortic valve depends on the severity of the aortic valve disease. So that's what we called as a stage, which stage it is. It is in the initial stages, it can be corrected with the medicines. And again, when a patient is diagnosed with a aortic valve disease, the surgeons come up with evaluations, and only then they decide, based on the severity, age, overall health, whether the surgery is needed to correct another valve or heart condition. So most of the time it's like a heart repair. That's what surgeons opt for. Only if it is in a worst condition where it cannot be, where the valve is completely damaged, like I was telling before, they will go in for a heart replacement. So minimally invasive procedure lowers the risk of infection, saving the heart valve, and may help the heart work better. So again, when you talk about a valve surgery, it depends on the individual condition. So some people, some patients may not be really a very good candidate for traditional open heart surgery due to the other problems they have. It can be related to the liver, lung, or kidney disease. So it will be making the procedure more complicated, the surgical procedure. So the surgeons have to, like I said, evaluate all aspects of the patient before jumping on to a conclusion. So they do a lot of tests and labs, and it depends on the physiology of the patient. And the age factor is one of the major factors, whether they could take, and whether they have any allergies, any kind of other ailments associated along with this. And then they come up with this aortic valve repair or replacement surgery. So with this, I'm going to in today's video. And if you like my cardiac channels, please do subscribe and stay tuned. Thank you, and wishing you all a healthy life. Thank you and God bless.